Welcome to The Explainer. Today, we're diving into a topic that is, well, just incredibly important: teenage depression. What we're going to do here is break down some expert advice into a really clear guide for parents to help you understand what might be going on and, more importantly, how you can actually help. Let's just start with a sentence that is absolutely chilling for any parent to hear. It's a phrase that hints at this depth of pain that can feel, almost impossible to wrap your head around. And the tough truth is, it's spoken way more often than any of us would like to think. And this really drives home just how urgent this is. 60%. That is the percentage of teenagers with depression who have actually thought about suicide. So you see, this isn't some rare or far-off problem. It's a critical reality for the majority of teens who are really, truly struggling. This is a tragic true story that was actually caught on a home camera. And it just highlights a terrifying reality. I mean, think about it. A totally normal moment. A boy is studying, his father is right there, just feet away, and in an instant, it turns into an irreversible tragedy. It's proof that the deadliest signs are often the ones we can't see at all. So what should we be looking for? This is so critical. You have to understand that the signs of depression really fall into two big buckets: the changes you can physically see, and then all the stuff that's happening on the inside. Okay, so these are the things you can actually observe, the tangible shifts. It could be that your kid suddenly has no appetite, or maybe they're eating all the time. Maybe they're staying up until 2 in the morning, saying they're studying, but they're just not sleeping. Or maybe they won't get out of bed at all. These physical changes are often the very first red flags. And then there are the changes happening internally, which, let's be honest, are so much harder to spot. Comments like, "I'm just a burden," or even a casual sounding, "I don't see the point anymore." Those are direct windows into their pain. We can't ever dismiss them. Now, what's really fascinating here is that some of the biggest signs won't show up in a medical textbook. A teen who suddenly disappears into gaming for hours on end, that's not just them being lazy. You have to think about it. In that game world, they get to be a hero, a winner, someone who really matters. It's a total escape from a reality where they feel completely powerless. That kind of withdrawal is a huge warning sign. And this brings us to the million-dollar question, right? The one that nearly every parent of a teenager asks themselves. Is this just normal teenage angst? Or is it something way more serious? How on earth are you supposed to tell the difference? Let's break down the crucial differences right here. First, look at the timeline and the severity. Normal moodiness, it passes. Depression is a deep, persistent sadness that sticks around for 2 weeks or more. A rebellious teen might argue, but they still basically function. For a depressed teen, just getting through the day is a struggle. And this is the most important one: normal rebellion does not involve thoughts of self-harm. So what even causes this? Well, it's almost never just one single thing. It's usually a combination of factors that kind of come together to create a perfect storm inside a teenager's world. Genetics definitely play a big role. If there's a family history of mental illness, that's a major risk factor. But so are all these external pressures, right? Intense academic stress, constant bullying, which now, thanks to social media, can follow them right into their bedroom. And, of course, big life traumas. But even something as simple as just not feeling emotionally connected at home can make them so much more vulnerable. I absolutely love this quote because it just illustrates the problem with relentless pressure so perfectly. We expect our kids to perform at 100 miles per hour day in and day out, but we never schedule a pit stop. And without that time to rest and recharge, burnout isn't just a risk, it's pretty much inevitable. The engine is going to break down eventually. We also have to kind of expand our definition of what trauma is. It's not always some big, dramatic event. For a child, that quiet, lingering grief for a grandparent who is maybe their main caregiver, that can be a wound that just never quite heals. Even moving to a new house, a new school, can feel like a devastating loss of everything that felt familiar and safe to them. Okay, so knowing all the signs and the risks, what can you actually do? This brings us to a practical toolkit for parents, real actions you can take starting right now. Think of these as immediate first aid techniques for emotional emergencies. You can teach your child that when they feel completely overwhelmed, they can just stop, take 3 deep breaths, or write down everything they're feeling, no matter how messy or chaotic it is. These little actions can ground them when they're in a moment of crisis. This might be the single most powerful tool you have. It's this simple message of unconditional love, and it needs to be repeated often. Whispering this to your child, especially when they're not expecting it, builds this incredible foundation of safety. It tells them their worth isn't tied to what they achieve, and that no matter what, they always have a safe place to fall. Now, building long-term resilience, that doesn't happen overnight. It's a process, and it starts with small, consistent actions that create a healing environment right there at home. A healing environment doesn't mean a perfect one, not at all. It just means a home where it's safe to feel. You can help your child find the right words for their feelings. Go beyond just sad to things like disappointed or ashamed or frustrated. Encourage small victories. That feeling of winning is a powerful antidepressant, and it doesn't matter if it comes from finishing a 5K run or just mastering a level in a video game. And, so crucially, know when it's time to call in a professional for help. Look, the goal here isn't to solve everything all at once. It's just to start, to open one door, ask one question, and let them know that you see them. So the final question is for you. What is one thing you can do tonight? Thanks for watching.